comfortable. And there are going to be some, well, I don't think I'm going to get to the examples today, but there's good reason that we should feel uncomfortable because we start, it becomes apparent that we haven't done the work that we need to do to be good citizens and to really understand the experiences of people of color. So anyway, this particular talk is one in, I'll say a series, but that makes it sound like it's going to be really frequently when it's probably going to be one a semester or something like that. It just so happens we have one scheduled for April 14th because we were fitting it into openings. If anybody has any ideas about, do you guys mind if I take this off? Are you okay? No. If anybody has any ideas about things that you'd like for us to talk about related to diversity, equity, and inclusion writ large, please let us know because we can try to find individuals that really, you know, are experts in this area. All I'm going to do today is present my experience reading literature, putting things together, just some things I've noticed that I found really interesting. That's all I'm going to do, and I hope that you'll want to join in the conversation. The planning committee, the PSOP DEI planning committee, worked behind the scenes to bring this to you. So I want to make sure that I acknowledge Dr. Crawford, Dr. Kong, Dr. Picard as well, because it's sort of emerged from some conversations that we've had, and they've kindly looked over my slides, although they've changed since you guys looked over them. So here we go. We'll see how this goes. So, you know, one thing that I find interesting is if we reflect back just a couple of years ago, 3 years ago, our world got turned upside down. And it's strange because I think a lot of us have lost touch even now with that experience. I mean, I remember March, thinking back to March of 2019, and we're told everybody's working from home, don't come in. And you go to the grocery store and the shelves are bare, and even now they're still bare, but for different reasons. You know, and there's like run on toilet paper. And those of you that live alone, you know, you're kind of in your apartments, your lives really changed a lot too. And then we also have individuals they lost loved ones to COVID. And I think all of us have been impacted by this to varying degrees, but it was really a very shocking, I remember too, the uncertainty. It was like, this is how we're going to do it today, and then tomorrow it's something different. There was just all sorts of uncertainty. We had to be masking. We would go out for a walk, and we were like walking up on the grass instead of the sidewalks to walk around people, right? Remember that, how that was? And now as we come back to like kind of being a little bit more, I don't want to say normal, but more the way it was, you know, I think it's really important that we hold on to these experiences, and I know others have said that we don't go back to things just the way they were. But another really, from a societal level, fascinating thing that happened was there was just this opening and this increased awareness of social injustices that had gone on. To some degree, you know, the last straw on the camel's back, as they say, was the murder of George Floyd, which we all were forced to witness on TV, a man who was being suffocated to death by a policeman. Trauma, and that's trauma, I'm saying, as a white person, not even putting myself in the role of what if I were an African-American person looking at this thinking this could be my dad or my brother. I can't even imagine the trauma that individuals who saw a mirror, right? A mirror. I'm looking at it and it's a window. I'm on the outside looking at it in. A mirror where I'm seeing myself more closely in this. I can't even imagine what that was like. But thankfully, that awoke some kind of response from many people, white people, all sorts of people, kind of coming out and saying, you know what, we are now seeing things that we did not see before. And in addition to that, and this might have been what fueled it to some extent too, I don't really know. I don't even propose to know, but there's a ripple that happened, right? That it's rippled, and we've seen it in other areas. And it's not just impacted who gets to present at the Super Bowl halftime. It's impacted commercials on TV. It's impacted all sorts of areas. The ripples have been widespread. It's also impacted us in science and medicine, I would suggest to you. And it's impacted science and medicine in several different ways, and that's what I wanted to do, was to take as we go through this, to think a little bit about how have these experiences rippled into medicine and science, and for us then perhaps to reflect on how might we feel called to respond or react. So this I really appreciated. Cell Systems, I'd never even heard of this journal, but this is a journal that's got an impact factor of 10, and they're calling out racism and COVID-19 represent a pandemic on a pandemic for Blacks in particular. The pandemics find themselves synergized to the detriment of Blacks and their health. The complexity of the combination of the pandemics are evident when examining the interplay between racist police practices and health. So they're specifically here. I think this is pretty profound for a medical journal like this to be calling out racist police actions. But they're recognizing maybe there is something about this synergy of this pandemic and then seeing how it's impacting communities differently, on top of the fact that we're seeing a man with dark skin being murdered on TV, that thankfully there was a reaction. So these are the latest numbers I could find. These are looking at the age-adjusted infections, hospitalizations, and deaths across a few racial ethnic groups as of February 8th, 2022. This is from the Kaiser Family Foundation, but it's actually data that come directly from the CDC. You can see the reference there. I just like the Kaiser Family Foundation because I thought the data were easier to absorb this way, so that's why I pulled this. It's also important to say that if any of you have been dabbling in this or tracking this, the numbers and the differences across the racial ethnic groups varied a fair amount throughout the epidemic when new variants came out. So these numbers have been reshuffled. So you can also see data at times where there were more white folks actually dying than there were folks of color. But this is just an overview of all the data to date since February. And as you can see here, Hispanic populations, American Indian or Alaskan Natives, in terms of cases, have experienced almost 50% more than at least African Americans and whites. If we look at hospitalizations, 2.5 times hospitalization rates in African Americans than whites, close to that for Hispanics, and then American Indians being devastated. And to a large degree, you know, this includes Native Americans that are living on reservations. So there's a whole portion of Native Americans living on reservations and then a portion absorbed into big cities and other places, so some being rural. So that's a different factors perhaps going on impacting that. And then looking at deaths. So if we take a look at this, then what I want to do is ask you guys, if I can go to the next slide. Why do you think there are these differences? What's going on?
Before I read the health affairs commentary, I would have said barriers to access could have been one of the reasons.
Yeah.
Now that I've read the health affairs commentary, I will say racism could absolutely be one of the reasons that you were observing differences.
Yeah.
I found it interesting to read that commentary, and they had specifically pointed to a paper where they hypothesized or added conjecture that it could be underlying genetic reasons, which seems incredibly unlikely for the data that you showed us. It seems like there are probably other societal factors at play leading to the difference between the groups that you showed, in my opinion.
Yeah. And that's all we're talking about today is opinion. And everybody's opinion counts. Yes?
So I'll answer your question, or I'll ask a question to your question, but so I was reading so I'm not a PSOP student, in case you didn't know.
We're happy to have you, though.
But I was reading a guideline from 2021 on aspirin, and there was a statement that said, race is an imperfect proxy for social determinants of health. And I kind of wanted to get your opinion on that. You were the first person to introduce that concept to me.
So I'm a psychologist, and we ask questions back to questions, too. So what do you guys think? What do you guys? Race is an imperfect proxy for social determinants of health. What do you guys think? And folks on the line, folks remotely, please feel very, very free. We would love to hear from you, too. Todd had to show off that he had read the article.
Yeah.
Yeah.
Well, I think the key thing here is kind of in relation to the answer to that question, like all these barriers that individuals face, right? I mean, barriers to access or, issues of patient mistrust, like, right, they can all be rooted in a racial system and, stems from racism and systematic and like internalized racism. So, right, so I mean, it's barriers to access. Why are there barriers to access? Oh, well, people live in areas where there's not good transportation. Why do they live there? Redlining. Was redlining about racism? Like, everything can be rooted back to that. But I think kind of going off like the imperfect measure for social determinants of health, right, I think that's hard for people to capture, right? Like, how do you, especially as you're doing quantitative work, it's like, how do you quantitatively capture systematic racism? And I think that people try to use race as a measure of that, but it's not actually measuring that. It's a proxy of that measure. And it kind of speaks to somewhat of what this article is talking about, which is for measuring it, we should try to measure what we're actually measuring and not this proxy that's not a good way to measure what we're trying to get.
Yeah. But it's a really very true point that it can be very difficult to get accurate quantitative measures of some of these social determinants of health. And yes, so what are other thoughts on that? Race is a proxy for exposure to adverse social determinants of health.
So I would love to bring up some kind of the terminology like opportunity. What is the kind of opportunity for the African American to take care of the COVID issue? And what kind of opportunity for the general white Anglo-Saxons and the Asians to take care of the COVID issue? So they're kind of priority issues for the COVID is important for us, or other kinds of the life matters are important for us. About, I mean, that they have to take care of the COVID, that there are more important things for their life. It's kind of the proxy estimate.
Yeah, I like that. So Kabum is talking about, it's more difficult for some people, the costs of working remotely. For many of us, we can work from home remotely. We've got a computer at home. We've got an environment where that's accepting and that limits our exposure. The cost to other people, many overrepresented amongst folks of color, if they tried to work, they just don't have jobs where they can work remote. They'd lose their job. That's just not a possibility. Similarly, just accessing masks or other kinds of antibacterial stuff. So, yeah, that's an important factor as well. Any other thoughts?
Dr. Picard has his hand raised.
Dr. Picard.
Yeah, first, thanks for hosting this and moderating it, Lisa. I do, sometimes I try to simplify things in my mind, and this idea of social determinants of health, just maybe starting with education and going, well, look, Asians have less risk than whites. Let's assume that that was a statistically significant comparison between the two subgroups. So why would that be? And given that you're the psychologist, Lisa, I guess I'll down and ask myself that, because I know you're going to tell me, well, what do you think, Simon? So maybe we have immigrants in the U.S. which are industrious, hardworking, and they work towards education quickly. And if everyone had an even playing field for education, we might not see these kinds of differences. But let's say the more highly educated you are, the more likelihood you have a good job and a higher income. And you know, when you look around your neighborhood that has $500,000 or $1 million houses, it might not matter what race or ethnicity there is, but when you take into account that, well, then you look at the blacks, for instance, and the Hispanics, and there's an awful lot of undocumented migrants in the country. They probably don't have the access to education. They're working these jobs that expose them to COVID, but they also just have less access to care and other social programs. So a lot of this dictates your health, and we know these things. So sometimes I wonder, what can we do about it? And I've come to realize over time, you know, coming from a place where homogenous population in Alberta, some of my black friends would say, well, Simon, race affects everything. And I'm like, I don't know what you're talking about, man. But over time, I have come to appreciate that perspective. And given that I have to jump off this call in a few minutes, Lisa, I was just going to give my 2 cents. It's remarkable to me how the systems and policies and awareness in the States have even changed in the past 20 years since I've been here. But there's no question that history has shown us that there's these embedded policies that have deprived blacks of education and jobs, civil service jobs, kind of thing that Woodrow Wilson did when the black communities across America were just getting really started in terms of prosperity. And so it kind of behooves us to educate ourselves about history. Interestingly enough, a place like Canada doesn't teach American history through rose-colored glasses. So I think we got the straight up, more straight talk than different regions of America. But I feel like as a white male, sometimes having even discussions about this, you're kind of disempowered to have an opinion to some extent, because you don't want to say anything that doesn't totally toe the woke line. And that makes it challenging for me to have discussions, open discussions, with anyone other than white males, unless I'm willing to take social risks with other people. And I think that, you know, I applaud you for having this conversation. And because I'm not physically in the room, maybe I feel a little more emboldened to say what I'm thinking, Lisa. So anyway, thanks for that little platform.
So Simon, no, I want to say thanks for speaking up. I know Simon was going to be a part of this, and then his schedule worked be here and share some interesting experiences that he's had from the editor standpoint. And I guess the one thing I would say in response to your comments, though, Simon, is I think it's unbelievably important that we as white individuals are taking responsibility for educating other white individuals, and so that you are in a powerful role in being able to talk to other white guys. That's really important, and that's, in many ways, that's where the work needs to happen, not just with white guys, with white women, with white people in general. So you know, don't dismiss that, because that's really important, in my opinion.
I think that big part of it too is utilizing perspective, but listening and reading and educating yourself.
Yeah.
I think that can contribute a lot too. And then you can go on and pass that knowledge on to others.
Absolutely, yeah. And I think, there's some experiences, I don't think I'm going to get to them today, but about that importance of before we speak, we need to educate ourselves, because if not, we can put our foot in our mouth, not knowing. It's our ignorance, because we haven't been exposed to this. Anybody else? Does anybody else have any? Yeah.
I guess some people might critique a certain action, like, oh, if you're into equity, why don't you go, like, march here, march there, march there? Like, this is generally speaking, not my philosophy, but, like, the opposition side to mention that. But I feel like the philosophy is, like, I'm quoting from the Boone Doctrine now, but it's like, Huey asked his granddad, he's like, what could you do if you can't do anything? Wait, hold on, how does it go? Sorry.
That's okay.
Like, if you can't do anything, but there's nothing that you could do, but you can't do nothing. And then the answer is basically just do what you could do. So we are in this room, we are healthcare professionals, so if you could do that, do that. We're also healthcare researchers. So if you could promote good research to help with equity or avoid bias that could cause further harm, promote that. If you could donate to mutual aid, do that, and et cetera, et cetera.
Yeah, everybody has to find their own thing that they're comfortable with. Okay, so I'm going to just move on here. What I want to do is kind of what Todd got at there too, is to show you a few different articles that I pulled up around this issue of understanding, like to try to get you a sense of how the range of different people's understanding of why we see this COVID impact differentially across racial ethnic groups. So this is an article from JAMA that explains that in the U.S., racial and ethnic minority status is inextricably associated with lower socioeconomic status. We're not sure why, but it is. This is part of the problem, part of the challenge we face, you know, is we put it out there. And I think everybody knows this. But the call is to question it. Why is that, okay? So Black, Hispanic, and American Indian persons in the U.S. are more likely to live in crowded conditions. Again, thinking about this is the explanation for the COVID spread we see. Live in multi-generational households, have jobs that cannot be performed remotely, such as transit workers, grocery store clerks, nursing aides, construction workers, and household workers. These groups are more likely to travel on public transportation due to lack of having their own vehicle. And even for persons who are at home, many of them with low income live with an essential worker, which makes them be exposed to it. So this particular JAMA article is really focusing a lot on the contextual situations that individuals have that, at least the way I understand this, is ultimately increasing their exposure to the virus. Does anybody else have another take on this or have anything else related to this one? Okay, so let's go on. This is a different article in JAMA. These just happen to be in JAMA. I wasn't really looking. This one, following adjustment for area deprivation index, which is an indices that's based on census level that's used in a lot of different research. So this is another, this area deprivation index might be another way of quantitatively looking at social determinants of health, right? Because you guys probably know the census data way better than me. This is an accumulation, the ADI, an accumulation or summary index of, like, you know, percent of individuals in that census tract that live in poverty, education, and a bunch of those kind of variables is what this is about. And so following in this study, they adjusted for ADI and clinical care quality. I haven't heard many people talking about part of the influence here might be the quality of care individuals were getting for COVID when they were diagnosed. We talk a lot about excess, but these individuals focused on the quality of the care. They found the risk of COVID positivity in African American and Hispanic individuals substantially decreased when they accounted for this area deprivation index and the quality of care, which doesn't exactly, quality of care I think was probably primary care, because a lot of these individuals, there's a focus on having comorbidities. So it wasn't quality of care once they got COVID contributing to mortality. I just want to be clear on that. However, even after they controlled for those, the risk for COVID positivity following the adjustment was still higher in those minoritized populations compared to the whites. So again, this is talking, we're still using proxies, right? We're still using proxies here for social determinants of health. And we're finding that we're picking up some signal, but it's not completely explained, which they're imperfect, so that's not all that surprising. But they go on to say they suspect that the overrepresentation of members of these groups in essential jobs, again, we've heard that. And then they go on to talk about comorbidities here, such as hypertension, obesity, also may have contributed to worsened outcomes, but they were talking about diagnosis up above. So this article, it's a little bit more, a little bit deeper, a little bit more reflective in that they're really trying to quantify some of these social determinants and using this area deprivation index and some kind of quality of care. So it's a little bit different, a little deeper. I hope you can kind of see that. Then here we've got an interesting article from the European Journal of Medical Research. This is looking at genetic susceptibility of COVID. Now, this is a European journal, and their focus is not so much on disparities squarely, at least from what they say. They're interested in doing an analysis of, there have been several studies, I didn't even know this, 38 studies I think is what they said, looking at some kind of genetic component that makes one more susceptible to getting COVID. But what they do here is they list these risk factors for COVID, including asthma, elderly age, pregnancy, underlying range of diseases. And then, curiously, they toss in experiencing lifelong systemic racism. I don't know, maybe it's just because I've been reading a whole lot of this stuff. I found that really European, I guess, in that it's like, let's put it all in a little box, and here's this systemic racism. Like, to their credit, they mention it, which is often, as I've read, and again, I'm not the expert in this area, I just read a lot of this stuff, doesn't happen a lot here, but so I just found this kind of interesting. But then they go on and they say connections to certain genes have also been found, although the susceptibility is yet to be established. So they want to understand that genetic susceptibility. But again, they're not necessarily in this paper saying that that genetic susceptibility that may or may not be there follows racial ethnic lines. They're just grouping everybody together. So again, I offer this just as another way for us to think about how we approach this, because oftentimes I'm the most guilty of this. I'm going to say we need to look at this by racial ethnic groups. I'm sure every single person in this room has heard me be disrespectful to Truven data because it doesn't have racial ethnic data in it. But there's an argument to be made that that's maybe not that important. Maybe it's important in describing the sample that you have, but maybe I'm being way too focused on it, which we'll get there in just a second. So anyway, this is just a different way. And again, I want you guys to kind of understand when in these discussion sections how they're talking about this. And here's another study that they are looking at ethnic disparities. They are really looking at COVID, but this is saying ethnic disparities. They're describing it as the residual risk in ethnic minority groups for COVID-19 deaths may be ascribed to unknown genetic factors, number one, or unmeasured phenotypes, most obviously racial discrimination. And maybe it's me, but I don't understand racial discrimination as being a phenotype. I thought that was something you observed. So I was really confused on this. Is that a euphemism for race ethnicity, or it could be my lack of understanding? But this article, unlike the other article that wasn't linking the genetics to the racial patterning of COVID, this one is. And this one is still putting forth this notion that maybe there's genetic differences. Maybe there are biologically based differences in individuals based on their race and ethnicity. And then we can get into this whole other argument about, is it self-identified race ethnicity, or is it I look at you and I tell you what your race ethnicity is, because those are very different, and we can go on and on. But this is just to give you a smattering of, in the scientific literature, how people are thinking about this and talking about this. I'm curious, does anybody have thoughts about seeing these different explanations? I know I've been spending a lot of time in this, so I may see things that maybe at first glance it's harder to see, but I wanted to just open it up to see if anybody had thoughts or comments about those.
If there's questions about whether or not there are genetic differences, ask questions about genetic differences, not about race, one thing. But exploring the causative factors of the observed differences between blacks and whites and Hispanics and whites, I think is important to do. Now, will we ever know definitively the reason? No, but we could probably rule some things out, right? We can rule out genetics if we measure genetics, not just someone's appearance.
Yes.
And if that's the intent of some of these papers, then I think it's meaningful.
Definitely, yeah. Thank you.
I think it's tricky if genetics are related to race, and race is related to outcomes via social determinants. I think it's a very difficult thing to unravel. I think it's very vague to say something like, most obviously racism.
Yeah.
Because what do you mean by that? And so it's important to say, is racism causing having a job that's, unsafe? Yeah. Is racism causing poverty in general, lack of nutrition? Is race causing domestic violence because of the neighborhood or passed along familial habits, if you want to call them that? They're related to structural racism. But when you just say racism, it's too broad.
Yeah, and you're already where I want to get with this. Yeah.
Two layers to that. One, absolutely, you got to. There's a movie. I got two references to mention. One, I forgot the movie. It's Black Men in White Coats. It's a movie about how we need more black men as doctors. And part of that movie, it mentioned how it's like, you can't just say just racism, because if you say that, people will just be like, well, I guess that's it. We can't do anything about systemic racism. But if you pinpoint it and can figure out why or how, then you can fix it. So I really like that point. The second one is the previous slide before this. It kind of reminds me of what we're talking about.
Which one?
Right there.
Genetics one?
The genetics one. It kind of rubs me the wrong way because it reminds me of how. Well, I believe this because that's how it was phrased in school, where it's like, oh, black people are more susceptible to diabetes. Just because of how it's phrased, I legit thought it was like genetics because of my lack of understanding. Like, I knew about socioeconomics, but I thought just from how it was phrased, it was about genetics. So this article rubs me a little bit the wrong way. And there's a great book by Dorothy Roberts called Killing the Black Body, or you can watch her TED Talk, which is Dorothy Roberts' problem with race-based medicine, which would, like this article might have good intentions, but could express concerns for such articles like this. So I highly recommend it. Dorothy Roberts, everyone.
Yeah, she's great. I love her. Dorothy Roberts, her mother was African American and her father was white, and she makes this point. She identifies as an African American, but she says, you know, my dad's white, my mom's African American, I'm as much European American as I am African American. And, you know, kind of the ludicrousness of forcing her into one category there, but okay. Anybody else? Yes. Yeah.
So by racism, are you saying that the problem that is the current system or the current system is racist, or maybe it's the problem the history, and now we are suffering the consequences? So maybe like those group of people, like African Americans or immigrants, were marginalized in the past, and like generation after generation, they are suffering the consequences, and for long term, we will have better outcomes for them, like just instantaneously. And also, like, if race is, so if race is acting in health outcomes through mediators, like income, like education. So if we like manage all these mediators, so race becomes irrelevant. So like if we have white male and we have like he like educate family like high social class, and the same white male but like poor and no money, no education. So this guy will have worse outcomes in many aspects of life. So it's not about race, it's about like education, money, justice. So like how do you define, so it's like going back to like how do you define racism?
Right. And you know what, Abdullah, thank you so much, and I mean that sincerely, for asking this question. Our planning committee had a little discussion about this, recognizing that a lot of individuals aren't kind of indoctrinated or acculturated to the U.S. experience in the U.S. A lot of this is U.S. specific. So I appreciate you bringing that up, and you asked some really important questions. I can take some time to go ahead and answer that, and then we can come back to this maybe later on, because that's fundamental. I think if we don't understand a lot of the points that you brought up, the rest of this is not going to really make sense. So I think you're aware of the fact, perhaps, you know, we've had slavery in the United States for longer than we've not had slavery. And slavery was a form of white individuals getting really wealthy and having a lot of power on the backs, literally, of African Americans. And there were a lot, and there still are, a lot of information, beliefs, stereotypes within our culture in the United States now that harkens back to slavery. And it is this idea that we white folks came up with a lot of reasons to justify why we could treat Africans, at the time they were Africans, that we had stolen and brought over, why we could treat them the way we do, why we could treat them as if they weren't human. And they're based on nothing that's factual. So by this, I mean things like African Americans, now I'm jumping forward, have thicker skin than white people. It's not true. But that was even taught in medical schools. And so I can go down this whole rabbit hole, but the idea is that history is the foundation for our society now. And so our society today was built, I'm trying to say it succinctly, built on the fact that white Europeans came here and set everything up, and they set it up so that we stayed on top, basically, so that we had easier access to money, power, and resources, and everybody else had less access to it. And it's hardwired, it's built into the system, is the thinking, and that's the structural racism. And we don't even see it. White people don't. People of color see it because they have to live it. But white people, that we don't even see it because we benefit from it all the time. So things that I can drive fast, a cop can pull me over, not to pick on cops, but, you know, and I'm going to be let go, whereas somebody else, person of color, get pulled over and a completely different outcome could happen. But it happens when I go to the grocery store. There are videos on YouTube. A white person, I write a check, no problem. Person of color behind me come up, write a check. I know nobody writes checks anymore, but when people did write checks, this is the case. You know, it's like, I need to see your ID. I need, this doesn't look like you. Trying to rent an apartment. Same name, you show up, oh, you're a person of color. You know what, we just rented it. White person come up, yeah, sure, it's available. So there is example after example of how the way our society in the United States operates is foundationally influenced by this history where it was set up so that white folks had the advantage. And that, you know, we used to, I think many years ago, point to people and call people racist. But that's not, I don't think that's that helpful, quite frankly. What we're getting at is that the structures, the way our society is set up, is structurally racist. It's unfair. It gives certain people advantages, white people advantages. And it's really hard to, part of what we're talking about is how do you measure this? What we see, kind of like the result of it, are the things that you mentioned. The result of it are those mediators. The fact that, like Carter was saying, redlining. So there are only certain neighborhoods where African-American people could live. And those neighborhoods got identified as being bad neighborhoods, redlined. And so people didn't want to come in there, and the housing values decreased. And this happened even now. If we look, if you superimpose the map of the communities, they came in and they identified communities as green, yellow, or red. The land, it was some insurance corporation or something. If you superimpose the one for Chicago on our neighborhoods now, you'll find the same neighborhoods that were deemed to be neighborhoods you don't want to live in are the neighborhoods now where predominantly people of color are living and they're struggling. And so it's those kind of forces that have set up the way our things operate, and they're just, it's not fair. I mean, other books to think about are The New Jim Crow, Alexander, I can't remember her first name. And it talks about, how racism's slavery's not ever gone away. It's a fantastic book. Slavery's never gone away. It's just taken different forms, and it's morphed into different ways of operating. But what we're talking about is, I think, is this notion of structural racism, and that is it's everywhere all around us. It's not that helpful to call somebody a racist. If it were that simple, it might be a lot easier to solve the problem. So we kind of have two problems. Racist at the interpersonal level, this person is acting in a racist manner, versus all of us white people are benefiting from systems that give us an unfair advantage.
Yeah, but you know, like, just a follow-up question. Like,
sure.
Could you blame, like, a son of a very rich father for going to very expensive school, while a son of, like, a disadvantaged father, like, going to very mediocre school? Like, someone might argue, like, it's like, why should, so I've been born to, like, a rich family, like, I'm gonna live this life. Yeah. Unfortunately for someone else, like, he was born to another family, so why should I pay for that selection?
So why should you pay for what? I'm sorry?
Like, so why should I pay, if I'm born privileged, okay, why should I care for someone, like, who's, like, just his fate or his destiny obligated him to live this life. Like, it's not my fault that the history was discriminating, okay? It's just like, I did not do any discrimination against them. This is like the devil's advocate, maybe.
Yeah. No, and none of this is meant to blame. And if I'm coming across as as sounding blameful, that's not my intention at all. There's no blaming. I mean, everybody, you know, lives their life. I think this is, and we shouldn't be pointing fingers at rich people. I'm also not trying to point fingers at rich people either. You know, Oprah Winfrey is a very, very rich woman. That we have African American and people of color that are very, very rich. You know, I think the other component of your question earlier was, is this really about race or is this really about socioeconomic status? And to that, and then we're going to need to end, to that I would say this. If you are a white male with income and you're a African-American man with, I say income, with a lot of money, and an African-American man with an equal amount of money, you are not going to have the same experiences in the world because of your skin color. And there are specifically, it's really, really interesting reading some of the history of the U.S. where our founding fathers literally set things up, at least my report, I wasn't there to observe it, but I just found this fascinating, to where poor white folks, they put things in place to make really sure that poor white folks felt like they were better than the poor slaves. They put a lot of effort into that. So there was intentional kind of patterning of where you could live, roles you could have, to just ensure that everybody knows where their lane is. But you asked some really, really important questions that, again, I'm not the expert in any of this stuff. I would encourage you, you know, read more and it will make more sense.
I don't mean to cut you off.
No.
There's a class coming in.
Sorry.
I actually think maybe instead of the next talk, we should have this conversation continue.
That sounds good.
So part 2 will be coming up on April 14th.
Okay, sounds good.
Thanks, Dr. Sharp.
Thanks, you guys, all of you.